Hi, I'm Dr. George Boris, and today we're going to talk about the transumbilical endoscopic breast augmentation procedure. I have done over 12,000 in the last 15 years. We do maybe 3 to 5 to 7 a day. And that's primarily because patients who have had it done love it, and they refer their friends, their relatives. People see it and they go crazy because there are no scars on the breast. Typically, the patients have a 20% chance of increase in sensation. We're not cutting the breast tissue, we're not cutting the muscle. 4 of my nurses came back to work the next day to surgery. One is a bodybuilder. She was at Gold's Gym, bench pressing, working out 3 days later. Recovery is very quick. The incision is hidden well within the belly button area, so there's no scar that is visible. We simply go under the skin, in the fat, under the muscle, and put the implants typically under the muscle to do the breast enlargement. And patients get a beautiful, very natural looking, non-surgical look. It's typically teardrop. This procedure is not for every person, but we find that we're expanding the indications the more we do it to patients who have more droopy breasts. We can use it for patients who have very tuberous breasts. But for the typical woman, it's a very, very effective procedure. It doesn't correct symmetry, and there are a lot of shortcomings in patients who have asymmetry in doing this procedure. But in general, it's a very effective procedure. The concern is, it is FDA approved. This is the implant, and we put it in through a tube that's applied endoscopically. And the concerns people might have is sometimes if patients don't have fat or breast tissue, they can feel the scalloping appearance of the saline. This is a silicone implant, and the silicone implant also has scalloping that can occur. But we typically put in a saline implant. The company did a survey and found out that 3% of saline implants over the lifetime can break, or water, which is all it is, could come out. And it's very safe. It's not like the concerns we had in the past with silicone. It's just water. And we've had, in our experience, over 12,000 people, probably 10. So it's far less than 3%. It's 0.001%, if that, of patients who've had a deflation. The company insures them and gives the patient 2 implants rather than 1. So on the 10 patients, I've had several who came in and said, "Can I go larger now?" And so that's what happens in some cases. On the others, we can take it out through the belly button and put a new one in. It's like calling AAA and asking to change your tire. They come in and an hour later they're out of here with a new breast implant. So I really recommend this procedure, and I think people really don't know very much about it and are always running to get silicone, when I think the saline can give a wonderful result.